Hey, welcome to the news cabin. Head on head here. Going to talk to you guys about herd immunity, about what's going on with the coronavirus, my thoughts on what we have now, which is a solution that's not a solution, shelter in place forever with no real ability to go back to the way things were. We never really had a plan. We don't have a vaccine right now. Okay, I don't understand. I've been saying this for weeks. I get on here and I talk about data, but I've never really told you guys what I think. And what I think is that this strategy of social distancing and having people not work, that would only make sense if we have a vaccine. Since we don't have a vaccine and we're not going to have one for presumably half a year or more, why are we not trying to do the inevitable, which is to immunize a large portion of the population? There's already some places that are showing immunity, and that's what we need to work towards. I mean, I just really, and I'm going to show you this article from the Boston Globe that talks about herd immunity as the only solution. But the media has really just not allowed this narrative to come out. And we look at, for example, Sweden. You look at what is written about Sweden, it's all negative. But the numbers, I'll show you the numbers, they have only 899 deaths on 10,000 cases. So the way that this response to the coronavirus has been talked about, and the fact that we just don't have a solution right now. We are going to have to get back to work. We cannot do this for months and months. And that's what I think that a lot of people don't understand. Shutting down the economy kills people. People have to work. People have to get out of that. And that's the big difference here, that there's so many people that just, they're getting paid. Their job's not stopping. And that's the upper tier of people, right? I mean, there's a lot of people. There's different realities going on right now. But what I don't understand is that the leaders couldn't foresee that this is not possible. What we're doing, this is not a long-term approach. We're going to have to go back. To shut it down completely would only have made sense if you have a thing that you're working towards, a vaccine. We don't have that. So why would we shut it down completely? It's bad science. There is, and that's the thing. So I'm gonna bring you right here this article. This is from the Boston Globe. Now, I will point out the Boston Globe has not been saying that herd immunity is the way to go. They've been saying we have to be safe. The only thing that matters is saving lives. I mean, so here's explaining why herd immunity is the only way to go. We don't have a vaccine, and we have to develop immunity within our community and protect the most vulnerable. You look at what the media says, all they are talking to you about is the case where the 32-year-old dies, the 27-year-old dies, the 45. It's like they're giving you the outlier because that's the news. That's newsworthy because you're a regular person too. So that's, what you care about. And that's really what shows within this coronavirus. Yes, there's a lot of people that are doing amazing things for their community, but the leadership has not been able to analyze this thing and provide a solution. The solution of shelter in place, shut down the economy for 4 weeks, and then eventually, obviously, open it back up, it's just terrible. All right, so last week, Governor Charlie Baker released projections of how many Massachusetts residents were likely to contract the coronavirus. By this reckoning, Baker said the state would experience somewhere between 47,000 and 172,000 cases during the course of this pandemic. This represents between 0.7 and 2.5% of the population. These numbers are daunting. Unfortunately, they are not nearly daunting enough, because while there is still a lot we don't know about COVID-19, including exactly how people are and have been infected, epidemiologists see there's still like this massive uncertainty. It's through droplets through the bloods, which is why we need to protect our mass. I mean, they always talk about these things as if we don't know anything. No, we know quite a bit. Won't begin to disappear until a far higher percentage of the population, at least 60%, develops immunity. So this is the goal. The goal was not to just sit there and do nothing for a month. The goal is to get the population immunized against this threat. And what did we do? We decided to just shut down the economy. There's just this is not a long-term solution. Look at what's going on in New York City. See if New York City is able to recover, from this if they don't get their act together and turn the lights back on, because you're killing your economy now and for the future. And the economy is people's livelihood, it's people's hopes and dreams. There's, again, there's this huge difference between people who, have the type of job that's just going to keep on paying them and working from home. These are people that are very happy right now. I mean, it's just how things are. There's some people that this has made happy, and there's some people that this has made sad, right? And we have to look at what is best for everyone. And the 4 weeks of shutdown and then opening it back up to try and get to immunity, which is what we need to get to, this was a bad solution. 4 weeks, the most pressing policy challenge has been relieving the life and death pressures on our hospitals, but all that justifiable emphasis on flattening the curve may have created a dangerous illusion that we can get away with relatively small infection rates. It's easy to forget that if a disease can't be contained, and it's too late for that in the COVID-19 pandemic, then there's only one possible ending to the story. We must collectively develop immunity to the disease. In lieu of a vaccine, that means most of us will need to be exposed to the virus, and some unknowably large number of us will die in the process. Okay, so this is just what it is. And it's like, I think that leadership was basically not able to tell us the hard facts, and they said, well, if we just shut down everything, then we're doing the safest thing. And that's what we have these days in 2020 is safe leadership, and it's garbage. Path to herd immunity, 4 weeks of social distancing. So this is what it's showing, is that if we do, the more that we protect ourselves now, then it goes all the way up to worse than it would have been. That's what they're showing us. So this right here, basically this line is enough social distancing to reduce intensity of spread by 60%, right? So what we're doing now, and this here was the 4 weeks of social distancing. And you have a better outcome if you naturally allow people to get infected, they develop immunity, and then in the end, that's what this article is saying, is that is, now these are projections, but this makes sense. Like, what I don't understand about our response is that it seems like there wasn't a plan. It really seems like, because you listen to Fauci get up there, and it's all these things, these people, yes, they have medical expertise, and they've gone to these different schools and all this stuff, but the guy in Sweden, he's the one who was an expert on spreading infectious diseases. And, again, they had a plan. All right, so delaying the pain, not eliminating it. 4 weeks of social distancing. So it's basically, what we're looking at here is peaks and valleys. They're trying to show us that if it goes up, then it won't go up as high later. And if it goes down, then it will go up higher later. And so what we're dealing with is peaks and valleys, and we have to get to immunity. And that's just what our strategy, thus far, our strategy has been a complete shutdown. And it hasn't really been a complete shutdown. The thing about herd immunity, too, is that you can concentrate your focus on getting the most vulnerable people to be completely isolated. Because now we basically don't differentiate between people who are older and have a bunch of pre-existing conditions. I mean, on a case-by-case basis, everyone is, more or less safe, and then this is really affecting people with anxiety more than anything. So because they're just afraid of so many different threats that could be coming at them. And, there's people that are in their 20s, very healthy, really should not be having this level of stress and anxiety about this, because they are simply not at a high risk of serious illness or death. But we can't tell them that. And really the main thing here is, we're not able to communicate things that are not nice to hear. We can't tell someone older, you're in a different position than we are. We want to say everyone's the same, everyone has the same amount of risk, we just can't be honest, right? And so, this solution of shutting down the economy for 4 weeks, while then we're going to obviously have to open it back up, and then we're just working towards immunity. So I think that it was not a good strategy. I think herd immunity is what the science tells us makes the most sense. I'm going to go in here to the numbers again for what Sweden is doing. Look at this. Sweden is all the way down here with 10,000 cases and only 899 deaths. Okay, and Sweden is a case they're doing not only herd immunity, but their treatment is so much better than other countries. Another big thing here to compare is again France and Germany. Look at these numbers: 130,000 cases with 15,000 deaths. Germany, 127,000 cases with 3,000 deaths. We talked about the potential of the reporting issue, but what have people have told me in France and in Germany, I know a lot of people there, is that in France they were not taking the people and they were not caring for them in the first part of the disease. They were waiting for it to get really bad. So it was mainly a difference in care and treatment between Germany and France. And so these are definitely things that we have to learn from. It's not a surprise that the German healthcare system is far superior to the French healthcare system. To me, my grandmother is French, and she would always complain about the hospitals. Everyone in France always complains about the hospitals. So, I mean, that is really one of the biggest factors: how were people cared for? Were they given the proper medications to make their mucus flow more, to just to take care of this infection, to treat them, and to not make them, in the end, not being able to breathe because they're completely stuffed up and completely taken over by this thing. So it was really a question of treatment. But if you look at the strategy that we have now, the main thing is that the herd immunity, it really seems like there's science behind it. The goal that we have to get to is to have society have immunity. Our current method does not accomplish that. So that's basically why I think that so far we've really had a terrible response. And people's livelihoods do matter. The economy matters. And the fact that we were just thought, and you just think the people that are in charge, who are making these decisions, they're so far removed from hourly workers, from all these types of people who are just getting crushed, like anyone who's in sales, who's doing new things of any kind. And it's like, to just say that those things don't matter, first of all, that's just not true. And then the other thing is that your solution was a non-solution. I'm just a YouTuber looking at the facts, and it was obvious to me that we didn't have a vaccine. Why aren't we working towards immunity? It's as simple as that. If you don't have a vaccine, then what we need to work towards is immunity. Children not going to school, what are you doing? If you look at the number and the amount of children, they're not dying from this at all. So they should be in a herd doing kid things in school. Like it's absolutely insane, the response. It's a lack of leadership. It's a lack of being able to be critical and analytical, to be looking for the truth, to talk to the people who know what they're talking about. That's how we got here to where we are now, with the biggest dent in the economy ever, and people who don't care about the economy, and who are not affected. That's the divide right now. And I can tell you, it's definitely, if you think about socioeconomic scale, the people up top, it's fine. A lot of them are just on vacation right now. There's a lot of people that didn't want to go to work before this. And so, I mean, it's really a terrible situation, and it's a lack of leadership, and it's a lack of understanding of how important the economy is. The economy drives life. Your work drives life. The routines that we have matter. What is an essential service now? The bike shop's not open, so if I get a flat tire delivering food, for people that I'm essential services delivering stuff, right? Well, is that part of it? There's so many different pieces. Like, we're all in this together. The idea that we can just shut it all down, and then basically just people who have the means can separate themselves. We talk about this disease affecting races differently. That is bullshit. It affects people of different socioeconomic statuses differently. If you're poor, you are not able to change your habits. You have to keep on going out and doing different things. If you're rich, you have another house that you might be able to go to. This is the thing that is absolutely ridiculous about the way the media portrays this. Another thing would be is that anytime you look at the media, you are guaranteed to see the story about the younger person who got coronavirus. Why don't you just show us what's actually happening? That's always the red meat story, because then it's like, oh my God, this thing is killing everyone. It can, but it's clear the numbers are stating we need to protect our older people. That would be, with herd immunity, you can put resources behind that. You can change people's habits in a more in-depth way, because you're not asking all of these other people who are vital to the economy to be changing what they're doing. I mean, that's what they did in Sweden. The older people are in a complete lockdown state. They are, you know, completely away from everyone else. And that's what the entire country is focused on. They're focused on taking care of their older people. What did we do? We pretended as if it didn't affect older people differently. That's what we did over and over again. And it's just been, I mean, you know, yeah, this is upsetting because the response is terrible. We still don't have a solution. The plan that we have now, who knows? I mean, it's just absolutely, you know, it's definitely not helping people to keep their hat on their head. I mean, people are losing their mind. I was in downtown Boston earlier. I saw a guy screaming on the street. I mean, there's people screaming, but there is a lot more people losing their minds right now than there were, you know, before this thing started. And for good reason. You know, this is, I really, what I'm conveying is that we never had a solution, and I don't understand why that is. The science is not actually that complicated. It's a virus. We don't have a vaccine. We have to develop immunity to it. Keep your hat on your head.